Hi friends, I'm Dr. Sashi from H2O Sashi, Dr. Sashi Eye Care in Salem, and we are going to be talking about very important topic today outside the eye. It's on erectile dysfunction. It's becoming a big problem among the males. The ED, as it is commonly called, this is a condition which affects many men at some point in their life. Your healthcare provider will work with you to identify what is causing your symptoms and the best treatment modalities available and how to address them. There are various injections which have come in the market. Pills are there, vacuum devices are there, and penile implants are also there to improve the erectile dysfunction. So these penile injections is what we are going to be talking about and how to go about doing it. It's commonly referred to as trimix or B-mix, and also now stem cells and PRP are being used and safely used as injections. So you take it on a syringe, add with 2 alcohol wipes to clean the area. Open an alcohol pad and clean the rubber stopper on top of the vial. Don't use the vial if the fluid inside is cloudy and has particles floating in it, or if the rubber stopper comes off the vial, which is prescribed maybe 1 to 2 units. Keep the tip of the needle under the fluid level and draw the medication. If you see air bubbles in the syringe, you can drop the extra medication, allowing the air bubbles to float to the top of the syringe and then slowly push out of the air. Look at the numbers on the side of the syringe and make sure you're using the correct dose. The injection should be kept at 90 degrees and angle, and in the middle third of the penis, not the head of the penis. Suppose this is the penis, not the head of the penis, in the middle third of the penis it should be given, and on the sides, either sides, not on the center or the below. Below is the urethra, the central are the nerves, and there are veins going on the sides, so try to avoid the veins. So the injection site should be either at 10 o'clock position on the left side or 2 o'clock position on the right side of the penis shaft. Each time you give yourself an injection, alternate from left side to right side. Don't use one side alone. Do not inject straight down on the top. Locate the correct area of the penis for injection, and to the opposite side where you plan to inject, you can hold it with 2 fingers with your hand position against the scrotum. You can also extend the penis against your thigh or for greater stability. Keep pulling on your penis for the time the needle goes into the shaft until it comes out. Do not twist or rotate your penis to avoid accidental injections onto the top or bottom surfaces. Quickly slide this needle into the shaft of your penis. Move your thumb to the plunger and push down the inject the medicine. Be sure to keep the needle in place. After injecting all the medication, quickly pull the needle out, straight out with alcohol pad. Just apply a little bit of pressure for about 2 to 3 minutes so that there's no blood coming out. If you are on blood thinners, apply it for a little longer, even 5 minutes, to decrease bleeding or bruising. Drop the syringes into the sharp container. You don't need to recap it. For 5 to 10 minutes after the injection, you may sit, stand, walk around, or start doing your other tasks to keep blood flowing downward. Don't lie on your back. That is the most important step. So medication typically takes about 10 minutes for the benefit to occur. The goal is to get an erection hard enough to penetrate penetrative sex lasting no longer than 1 hour. You can inject the medication up to 3 times a week, but not more than that, and no more than once in 24 hours. Keep a journal to help your providers adjust the dosages as needed, included in the dose injected, the hardness and duration of erection, and any symptoms associated with the current dose, such as burning, pain, bruising. Be aware of these warnings related to penile injections. 24 hours before or after the penile injection therapy, if you have these things, please report to the doctor. If the medication doesn't work, don't give yourself another injection for at least 24 hours. Do not go to sleep until your erection is bendable. If your erections are lasting longer than 1 hour, consider reducing your dosage by 2 units. If you experience an erection that is hard and not bendable, lasting longer than 2 hours, take 2 30 mg tablets of an over-the-counter pseudoephedrine hydrochloride, also known as Sudfed, for immediate release. Pseudoephedrine. Don't take extended release or long-lasting tablets such as Sudfed 12-hour. If your erection remains hard and not bendable after 30 minutes, take 2 more 30 mg tablets. And if your erection remains rigid for more than 3 hours, go immediately to the nearest emergency department. Erections remaining hard for more than 4 hours may result in permanent and irreversible damage to the penis. Injection therapy is not for everyone. Some men may be unsatisfied with this treatment due to pain, ineffectiveness, or they might not like needles. Several other options exist, including penile implant procedures, which is an alternate to injection therapy and is covered by a lot of insurance companies. If you're not satisfied with your injection treatment and want to discuss other options, please reach out to your urologist. Similar like these medications also are stem cell therapy and platelet-rich plasma, which are also giving good benefits. Thank you.